Hospital's YouTube channel. Now, if you'd like to find out about male factor infertility, please visit our previous video. In this video, we'd like to talk about the most common form of female factor infertility and what type of treatment you should avoid and what you should go for. Now, by far, the most common form of female factor infertility is known as tubal factor infertility. Now, 99% of the time in couples, it's usually female infertility that's causing the lack of pregnancy or difficulty in conceiving. Only 1% of the time is caused by male factor infertility. And in that 99%, by far the most common factor that we see over the past 20 years is fallopian tube disorders. Now, some form of factor of the fallopian tubes, now you have two fallopian tubes, one could be affected or both could be affected. Something is obstructing the delivery of the fertilized egg, or there is no fertilization occurring at all because of the blockage. The egg cannot meet the sperm. Usually it can be congenital, it can be something acquired. So you may be born with a deformed fallopian tube opening which is too thin, the fallopian tube hand is too thin, too narrow, affecting the delivery of any type of egg cells, and you can be born with a lack of cilia that actually is a very hair-like substance that moves the released egg to the place to get fertilized. That could be another factor. There could be some form of damage that's obstructing the delivery. There can be some blockage that's present there. It can be caused by fatty fallopian tube, making it too heavy, or the angle is different. Several factors of this fallopian tube disorders. Now, very important that we need to do is diagnosis. Number one step that we want you to consider to diagnose fallopian tube factors. First of all, you need to go for HSG, which is a hysterosalpingograph. This is an X-ray of the uterus where we pump in iodide liquid into the cavity of the uterus, into the fallopian tubes, and it can easily tell us what's going on, which fallopian tube is being blocked, which fallopian tube is actually functioning. Now, it can be both fallopian tubes that have been blocked, or usually the case is only one fallopian tube is being blocked. Now, treatment is very important as well, because in conventional hospitals, immediately they tell you to remove that fallopian tube because you still have one more. But what they don't tell you is that you immediately reduce your fertility rate by 50%. And if you get that blocked again, they will ask you to remove that as well. And this time your relative infertility patient become an absolute infertility patient. You have no chances of getting a natural pregnancy anymore. And this is what happens to many patients going to treatment at conventional hospitals. Please avoid going down that route. At Antai Hospital, we can actually treat this condition without having to do any form of removal. Because at Antai Hospital, our goal is to help you achieve a natural pregnancy. Please avoid doing unnecessary organ removals, especially fallopian tube removals. In this case, it's entirely treatable. At Antai Hospital, we have developed a specialized technique that uses 3D laparoscopic surgery with a cook wire and a fallopian tube stand. We can easily remove these blockages, these deformities, realign the shape, the angle, or if there's some form of blockage in the opening as well. All of this can be restructured and removed, and natural pregnancy can be guaranteed after our treatment. The important thing that you want to keep in mind is that how do you avoid getting a blocked fallopian tube, or how did you get it in the first place? It's usually caused by history of abortions, whether induced abortions or medical abortions. Something that's causing the blockage is usually a pregnancy tissue. It could be an embryo. So when in medical abortion, when you take a medical pill to abort the pregnancy, it calcifies the embryo and it can grow into a growth, tumor-like, which is benign, but it's not being removed, and it completely blocks the passage of the fallopian tube. In induced abortions, the scraping process can damage the fallopian tube, especially the opening connecting the uterus and the fallopian tube. That one is also easily damaged. And now you know, if you have a history of induced abortions, usually it can lead to tubal factor infertility, but rest assured, treatment is available. Avoid getting unnecessary removals and come to Antai Hospital to get a proper treatment where we preserve the organ and restore its function and allow you to get a natural pregnancy after treatment. please get in touch with us via the website and also leave me some comments down below. Stay tuned to the next one.